Hi, my name is Dr. James Lee. Today I'm going to talk to you about liposuction, how it works, and who is an ideal candidate. Liposuction is a minimally invasive surgery which is done in the operating room through very small 5mm incisions. So depending on the area that's going to be treated, usually 2, maybe 3 small incisions are made where a liposuction cannula, which is just a hollow tube, will be put in to suction out the deep fat underneath the skin. An ideal candidate for liposuction is someone whose weight has been fairly stable for at least 6 months and comes in complaining of a certain or a specific area that's been bugging them. For example, a common area is the lateral hips, where someone is wearing yoga pants, for example, and there's an area of bulge. So that is the perfect area to contour with liposuction. Fat that is amenable for liposuction is fat that's subcutaneous or underneath the skin. So the way to know if you have subcutaneous fat is if you could pinch your fat, and that's the fat that can be taken with liposuction. Some people have visceral fat, so that's the fat inside the abdomen around the organs. That kind of fat you cannot pinch, you cannot see. That's actually the unhealthy fat. So the way you can know is if you feel that you have a very rounded abdomen, for example, but you don't have much fat that you could pinch between your fingers, you're probably someone who has more visceral fat than subcutaneous fat. So someone who's planning to have liposuction or looking into it, here's what to expect. We do the surgery in the operating room. There you're going to receive local anesthesia so that you feel very comfortable, and IV sedation, so medications through an IV so that you feel very relaxed and sleepy throughout the procedure, and that the time flies during the surgery. So through small incisions, we infiltrate a liquid, and then from there we're able to suction out the fat. So we do multiple passes here. So we always try to first separate the fat using that tube, and then we aspirate the fat so the fat is sucked out, and then we do what's called feathering. So we make sure that we break down some of the fat so that you have a nice smooth contour. During the surgery, it's not uncommon that I'll ask the patient to kind of turn around a little bit and shift their body, because we want to make sure it's perfectly smooth before we come out and not have any irregularities. After the surgery, some of the incisions may be left open for some of the liquid to egress out. This is to help minimize the amount of swelling that you have and the amount of swelling that your body will need to resorb after the surgery. We give you a compression garment to compress the area that was treated, and this again helps minimize any swelling afterwards, but also helps kind of the skin adhere back to where we want it to be placed. A common question that I guess asked all the time during liposuction consultation is, can the fat come back or does it just go elsewhere? So just to kind of explain that everyone in their adult life has a set number of fat cells. Think about that as the number of parking spots in your body for fat. So once you have a set amount of fat cells, when you gain weight or lose weight, those fat cells increase or decrease in size. They're not actually multiplying. Liposuction removes certain fat cells permanently, but it does not mean that there are no fat cells left in your body or in the treated area. So if you do gain weight or let yourself kind of go and eat whatever you want and stop exercising, you will gain weight. However, you will gain a little bit more evenly throughout your body rather than having those specific areas that bulge out. So another common question I get asked during liposuction consultation is, should I lose as much weight as I can before the surgery? So the simple answer to that is no. You want to be able to maintain your weight, whatever you are pre-surgery, after surgery, in terms of diet and exercise. So you don't want to crash diet and do tons of exercise before to lose as much weight as possible if you're not able to maintain that afterwards. As long as you maintain a healthy lifestyle and diet, then you should stay at the weight that you're stable at before surgery and maintain that afterwards. And the third most common question I get asked during liposuction consultation is, will it tighten my skin? So liposuction alone, be it power assisted, traditional suction assisted liposuction, or even laser liposuction or vaser, all these modalities, the goal of it is to suction out the fat. So there is some degree of skin tightening. It could be described as between 0 to 5%, so not much. So anyone with excess skin is not an ideal candidate for liposuction. If there's a large amount of fat to be removed and the skin has lost its elasticity, for example, from pregnancy or from significant weight fluctuations, then maybe you don't want to remove too much fat during liposuction, which could cause loose skin. And in those cases, we're thinking more about a skin excision procedure in conjunction with the liposuction, such as a tummy tuck. Thanks for watching, guys. I hope that I was able to answer some of your questions. For more information, visit our social media platforms like Instagram or Facebook, or visit our website. And of course, you can call or email our office at any time.